All of those treats around the holidays may not be so great for our blood pressure. Doctors say making minor adjustments in how you cook and bake can be just as effective as medication. A new study from CNN found cutting just 1 teaspoon of salt every day works just as well as blood pressure medicine. So joining us now, we have Dr. Fahmi Farah, a cardiologist. Doctor, what do you think about this study? Do you agree with this?
I do, as a matter of fact. Yes, salt is one of the key ingredients that causes us to have elevated blood pressure, and just cutting back salt from your food, it can significantly improve your blood pressure. And sometimes we can even get people off of their blood pressure medications with this change.
I mean, that is incredible. So where is salt sneaking into our diet that we don't realize? Oh, I didn't salt my food, but maybe it was already there.
You're absolutely correct. There are some foods that are not even salty at all. For example, your breakfast cereal that is packed with sodium, and it can have a similar effect to having salt. Like a lot of processed foods that are pre-prepared will just be packed with sodium, and those are the ones we need to avoid.
So what are your best tips for, obviously we're coming up against the holidays. We're going to be eating a lot of food we don't normally eat. Are there some usual suspects we should be avoiding or use a very small moderation with?
You're right. Holiday foods are packed with high sodium content. Gravy, I would have to say, is one of the biggest culprits. So minimize the amount of gravy you put on your food. Turkey, how you brine it, like maybe avoid brining it because brine is packed with salt. So it's just little tweaks like that can make your food a whole lot healthier.
We always think about processed food or maybe something that can stay in the freezer, our easy, quick pop in, heat up dinners. Are those pretty sodium laden?
They certainly are. Anything that's pre-made, whether frozen or canned, it's going to have a ton of sodium in it. So the general advice I have for my patients typically is try to make your own food. Preparing your own meals is really the best way to go to be able to avoid the heavy amounts of sodium that other foods will contain.
So what is the idea behind that salt may be good for you? Do you agree with that, or I guess moderation? What do you think about that?
Moderation is definitely key, but I don't agree that salt is good for you. Of course, some amount of salt is necessary, but the amount of sodium that's already pre-contained within the foods that we consume, we really don't need to add that much additional salt. We say, for a lot of our patients, we say less than 2,000 milligrams of salt, which is not much salt at all.
Okay, give us our doctor's orders as we head into the holidays. We're thinking about our salt. We'd love to get off that medicine. Give us our takeaway, Doc.
Yes, blood pressure is one of the biggest risk factors for cardiovascular disease, including heart attack and stroke. And one of the key culprits of it is salt. So I encourage everybody to avoid sodium, heavy salt foods, and just be healthy this Thanksgiving and prepare your own meals as much as you can.
Yeah. And happy holidays, happy Thanksgiving to you.
Happy Thanksgiving, everyone.
Thank you.